Matt Seymour was talking earlier about rare cancers. That actually is where pediatric cancers fall in, thankfully. And the big issue there is training. So how do we go about training general practitioners, nurse specialists, adult oncologists, pediatricians who don't know anything about oncology? How do we get the message over about how important it is to find pediatric cancer patients early and put them through specialist centers, etc.?
I think, training is definitely extremely important, but before elaborating on the training, I need to make perhaps a remark about rare cancers. Because what is the definition of a rare cancer? Of course, according to the definition, pediatric cancer is rare because the incidence which is described in the literature is anything between 1% of the total cancers, 2% of the total cancers, up to 10% of the total cancers. The reality is that we don't actually know because most of the countries in Africa do not have a registry, so we are basically guessing, or we have estimation based on the global can. But this being said, of course it is a rare cancer unless the family that has a child is affected by this disease, because then despite the fact that it is rare, that family really has a fantastic burden and a lot of suffering. So this being said, training in pediatric oncology is extremely important. It is important because most of the people involved in diagnosing cancer are actually the nurses or actually the general practitioners. And if we look, again on the African continent where I do most of my work, that we do have actually a quite limited number of pediatric oncologists. We've done recently a survey including most of the countries on the African continent, and some of the regions basically do not have any specialists. So they are either the pediatricians who are treating those children, or the general practitioners, or sometimes the adult oncologist, and they do lack the required experience. Because despite the fact that pediatric oncology deals with cancer, the training between adult oncology and pediatric oncology is completely different. So this being said, at the moment, there is on the African continent where I do most of my work, a school. It's the Franco-African School, which has as aims to train as many doctors in pediatric oncology, and not only specialists but nurses as well. And we are planning to develop the curriculum on the sub-Saharan Africa as well.
And how are you going to disseminate that? Not everybody can afford to come to a school meeting face-to-face, although it would be ideal if they could.
At the moment, we are trying to develop a system by which we could have twinning programs between different centers in Africa, which obviously it will be the easiest to work, and then spend a certain amount of time in those recognized and specialized centers, and then of course having, case scenarios and case discussions, and based on that at the end have a diploma which will give them, let's say, more knowledge in diagnosing and treating the children with cancer.
Ecancer is dedicated to developing educational modules. Would you see any role for that in terms of networking?
Definitely. I mean that will be the way to go, because as we all know, it will be extremely difficult to take those doctors and get them for 2 years or 3 years in a specialized center. So obviously the e-learning and using such a technology will be for the advantage of all.
How do you get the message over that children with cancer should be in an expert center? Or is that just logistically impossible?
That's quite difficult. I mean, obviously this is the ideal solution where we could really centralize, the knowledge and also the equipment, which is not always available, and in most of the situations could be quite expensive. But sometimes it's quite difficult because, as you know, patients need to travel, for very long distances in order to reach their center. And the mother, who comes with the child to the specialized center will leave behind, a family with many other siblings. So despite the fact that this is the ideal scenario, perhaps it will be quite difficult to implement. So the in this situation will be perhaps acceptable to have the child diagnosed in a specialized center and then to try to let the child go to the nearest clinic where basic investigations, follow up, and administration of chemo, let's say oral chemo, could be given. Despite that, one needs to be really careful about the side effects and really a very close monitoring of those children.
Psychological care is also important, and particularly for the whole family. How on earth do you deliver that in Africa?
Interestingly enough, about this topic, we are having tomorrow actually a workshop on the psychosocial problems, dealing with the trauma of the families, and actually not only on the families, but of the entire society, because, a child with cancer does not affect only the child as such, but an entire, environment, the family, then, the working place where the parents do work, and the whole society. So we have special programs. Obviously, it's still at the very early and the very beginning trying to address this problem, such as, palliation, for example, which is quite an important aspect, and it is quite difficult, in some situations to deal with these psychosocial problems.
The ecancer has published 20 modules on palliative care in Africa. Is that helpful or not? I mean, it doesn't deal specifically with children, but of course children make a large part of the
Definitely it is an essential component. However, there are still many centers which do lack, essential medicines such as morphine. So one really needs to keep going on trying to increase awareness and trying to really let the government know and do more, because it's actually not always about the cost, because the cost of the morphine or the cost of the palliation is not always as high as it is mentioned. So I think from this point of view, advocacy, increasing awareness, education will play definitely an important role.